All right, so welcome everybody, and thanks for joining us. In opening our time together here, I want to start by saying that I'm joining from Toronto in Treaty 13 territory. And I want to acknowledge that we are gathering here, as we do most days, on the lands of many Indigenous people of Turtle Island, both recorded and unrecorded. And it's important for this ongoing process of reconciliation that we not only acknowledge whose land we're on, but also that we strive to create services and resources that appreciate and include the experiences of Indigenous people. And what a better jump off point than this webinar right here, promoting equity and evaluation. So my name is Taylor Harris Mungo. I'm one of the knowledge and research leads here at CICMH. And I just want to say welcome and thank you all for joining us. So before we start, just a few housekeeping rules. There is closed captioning at the bottom of your screen for anybody who would like it. There should be a little CC button. There's also a chat function for discussing any thoughts or reactions, and a Q&A function is available for submitting questions to panelists. Our presenters today are using a program called Menti. So you can see it up here on the screen. This is the code at the bottom to access the room. So it is going to be an interactive presentation. So please feel free to get that on your phone or on a separate web screen so that you can follow along and join along. And any questions will be taken up either through Menti or at the end of the presentation. And after the webinar, a survey is going to pop up on your screen. And if you could fill that out, that would be super helpful. So without further delay, I'm going to turn it over to our fantastic panelists.
Good afternoon, everyone, and thank you so much for joining us today. It's a great pleasure to be here with all of you. So first, I'd like to just introduce myself. I'm Daniel, and my pronouns are he and him, and I'm joining you from Casey House, where I work as a measurement and evaluation specialist. And joining me is Dr. Deb Chiodo from CAMH.
Good afternoon, everyone. My name is Deb Chiodo. I'm the Director of Data Management and Evaluation for Youth Wellness Hubs Ontario. I use the pronoun she and her. I live and work in London, Ontario, which is the traditional lands of the Anishinaabe, Haudenosaunee, and Wendat people. I am here with much gratitude and very grateful to be able to talk with you all today. And Daniel and I have put in a lot of thought and reflection into what this webinar is going to be about. And Daniel, before we start with some other acknowledgement and gratitude, I want to just say that, Daniel and I, and Daniel, I'm going to speak for you, we are not experts in evaluation that incorporates equity all the time. We are not experts in equity. What we are is committed and passionate about ensuring that the processes, the approaches, the frameworks, and the reflections that we do in our research and evaluation incorporates a health equity lens right from the start, and that we recognize our limits and our understandings, and that we include and engage those people that can help inform, can help design, can help develop our evaluations with health equity in mind. And we developed this title probably 6 months ago. And this week when I was talking to Daniel, I said, you know what, I don't like this title anymore. It's not about promoting equity and evaluation. It's about doing equity and evaluation. It's much stronger than that. It's about it being integrated into every aspect with respect to design, development, decision making, including. So we left it for now, but that's just kind of where we landed after preparing.
Thanks so much for that, Deb. And before we get started, I also like to acknowledge that I'm joining from Toronto, and I'm very thankful for the opportunity to be here in this land today to share this presentation with you folks. So with that said, let's go into our first interactive activity. So as Taylor mentioned throughout this webinar, we will be asking you to participate in some interactive activities. So to participate, we will be using the Menti website. Oh, perfect. Some of you have already started adding your hellos. So yes, for this part of the presentation, we just want to get everyone saying hello to each other. And if you could say hello in the language that you learned in early childhood, that would be great. So we'll give everyone a minute or two just to greet each other, and then we'll continue. Great, that's awesome. And as a Spanish speaker, it's always nice to see Hola on the screen. So Hola to everyone who speaks Spanish. So let's get started. So let's move on to our webinar key messages. So by the end of this webinar, we are hoping that you will be able to take away the following key messages with you. So the first message is that equity and intersectionality play an important role in evaluation. A strong understanding of both of these concepts will allow you to promote equity in all phases of your evaluations. To ensure that your evaluations are relevant and meaningful, it is important that you are engaging key stakeholders from the start to the finish of your evaluation. It is important to understand the context of your programs and participants. This information will allow you to verify that your evaluation approach is relevant and meaningful to them. Power differentials and diversity can really influence the quality of your evaluation. It is important that you are sensitive to and aware of these phenomena. It is useful to take a strength-based approach to evaluation. And lastly, social demographic data plays an important role in promoting and advancing equity in evaluation. So we have another interactive activity now. So again, using the Menti or going on your phone or on the web browser and using Menti, please use one word to describe equity or how you think of equity. And again, you can go to menti.com and use the code that you see above here to participate. Great, and I'm loving all the different words that folks are putting here to describe equity. And I really like that fairness is right in the middle and it's standing out. That's awesome. Okay, so we'll move on. So first, we want to use this cartoon drawn by Tony Ruth to expand on an understanding of equity. But to better understand equity, it is important that we first understand inequalities. In the picture that you see on the screen, we see a bent over tree with apples growing mainly on one side. You can see here that the figure on the left, so the figure in the red effortlessly waits to catch falling apples, while the figure on the right stands questioning and waiting. So the person in the blue. This picture is a great example of an inequality, which essentially is a phenomenon of unequal and or unjust distribution of resources and opportunities among members of a given society. One important thing to note about this cartoon, the bent tree that is shown here might suggest that today's staggering levels of inequality are at some level natural and or to be expected. However, it is very important to acknowledge that this assumption is far from the truth and reality. And in fact, there is nothing natural about inequalities. They are a reflection of intentional systems of oppression established in the past that continue to privilege some people over others. Now we're going to briefly talk about equality. So in this picture, we see that both figures have received the same ladder and shoulder bag. In other words, both of the figures that we see here have received the same resources and the same support. But as you can see from the picture, even though they've both received the same resource and support, only the figure on the left is close enough to reach and collect the fruit. And again, the figure on the right is still unable to reach them. Using this cartoon as an example, equality can be understood to be the equal division of resources that does not factor differences in need and ability. The main point to understand here is that equality does not always work for everyone. As seen in this cartoon, the figure on the right is still unable to reach the fruit even after they've received the same resources and the same supports as the figure on the left. And now this brings us to equity. So what is equity? So equity is not only dividing resources fairly and equally, but it's also factoring differences amongst the different people you're working with or you're supporting. So differences such as race, socioeconomic status, and other key markers that would require different supports to ensure the same opportunity of success. This can be shown in the cartoon that we see on the screen by the different height of the ladders that have been provided to each of the figures. So the figure on the right has a taller ladder because the tree is higher on their side, whereas the figure on the left has a shorter ladder because they have a shorter distance to reach to gather the apples. So here they have different size ladders to make sure that they are both able to pick the apples. And lastly, this brings us to justice. So we'll briefly just quickly talk about justice. Justice can be thought of as long-term equity. It looks to create equity in systems. So in other words, justice can take equity one step further by fixing the systems in a way that leads to long-term, sustainable, and equitable access for the generations to come. So it's long-term, sustainable, and for the generations to come. As seen in this image, both figures are given the same size ladder, but instead of giving them different ladders, you can see that there's supports that have been added to the tree to ensure that they both have the same access to the apples. One thing and one interesting observation about this cartoon is that if you think about it, there is really no need for the ladder since the number of apples that would fall from each or both of the figures would be the same if they were standing on the ground. So this is just a quick definition of inequalities, equity, equality, and justice. The graphics that we just talked about demonstrated only two groups. So this was just looking at the two figures trying to reach the apples, affected by one disadvantage, which was the tree curving towards one figure over the other. Unfortunately, this graphic fails to demonstrate people's overlapping identities and experiences and how they can be affected by a number of discrimination and/or disadvantages. The concept of intersectionality was coined by Kimberly Crenshaw, who explains that our identities are like traffic flowing at an intersection. One identity may flow in one direction, while another identity is flowing in a different direction. In other words, intersectionality is a metaphor for understanding the ways that multiple aspects of our identities collide and converge, and how multiple forms of inequality or disadvantage sometimes compound themselves and create obstacles. But what does this really mean? So this graphic here will help us better understand what intersectionality means. So in other words, intersectionality means that people are often disadvantaged by multiple sources of oppression. And this can be as a result of their race, their class, their gender identity, sexual orientation, religion, and other identity markers. Intersectionality recognizes that identity markers, so for me, as an example, being a man of color, do not exist independently of each other, and that each identity marker informs the other, often creating a complex convergence of oppression. So what does this mean, or what's an example? So for example, the experience of a Black woman may face disadvantages based on both her race and gender, while a homeless cis gay man might face discriminations due to their social class and their sexual orientation. But why is this important? So intersectionality is important because it forces us to think of people and communities beyond the single marker. So for example, it forces us to think about people beyond just, let's say, for example, thinking of gender, so men versus women. And the thing with this is that thinking of communities or people as single markers can lead us to false classifications of people. So intersectionality helps us to understand that groups in society are affected by their position in multiple systems of power and oppression that changes over time and place and in different institutional contexts. And as such, intersectionality helps us to have an accurate understanding of the needs of different people and communities that we aim to serve with our programs or initiatives, and thus it allows us to find solutions to address and meet their needs. So now Debbie will talk to us a little bit about the relationship between equity and evaluation.
Thanks, Daniel. Daniel, if you could just drop the Menti code again and the link. There are some people asking, and I couldn't do that right now. So equity and evaluation, I've probably been doing research and evaluation for more than 20 years now, and in multiple different sectors, a lot in education, both elementary, post-secondary, secondary, and also in communities. And 20 years ago, we weren't asking questions that centered equity, diversity, inclusiveness in any of our research designs. At most, we were asking some basic demographics. Were you male? Were you female? Are you other? It's embarrassing to think now what we used to do in terms of the tools that we used to use and the processes we used to use. And the purpose of evaluation has really evolved. So I don't think you can, submit a proposal anymore to any grantee or funding agency without actually demonstrating your commitment to equity in both the project as well as the evaluation, in your analysis of the information, and how evidence is gathered and how it's used is really important, because it matters from an equity or a diversity or inclusiveness, because evaluations that are done wrong, and by wrong I mean don't incorporate components of equity, can be further exclusionary, can further disadvantage people, can make them invisible, and can further disadvantage marginalized groups. So insofar as that we can really focus intentionally on how can we make our evaluations better, designed to account for equity issues, we absolutely must do this. So equity and evaluation, it really challenges us to think differently about our work. Who is defining for you in your projects, in your evaluations, what's important to learn or study, and for whom? And do our funders or do our leaders, do they get to decide which questions, what outcomes, what indicators are relevant? When we start aligning our practices with an equity approach, we make a commitment to engaging stakeholders that are going to be impacted by the evaluation that we're conducting. Meaningful youth and family engagement is something that I will not engage into a project any longer unless I can involve youth and families right from the start to design my proposal, to inform the questions, to think about the approaches, because it's about them, and so they absolutely have to be involved from that. Are you thinking about perspectives that are normally unheard or discounted for? And when we start to do those processes and we start to kind of include and align our practices with an equity approach, you can advance equity. When you start to ask questions around who's accessing your services on campus, and what are the differences in access, and what are the differences in sort of service experience by different groups of students or different groups of clients, and is there an impact by different groups? You are advancing equity because you are going to then generate evidence that tells us there are certain factors that have led to our understanding of experience differently for different people. And I'm a scientist by like training in nature. I believe in rigorous evaluation. I believe in randomized controlled trials, all 100% every day. However, working in real world settings as I have my entire life has also challenged me to think about different concepts of validity and rigor when it comes to incorporating equity in our evaluation. There are multiple truths. When you start really using other approaches to collect data, such as storytelling, such as photo voice, such as sort of in-depth interviews that are ethnographic in nature, you will see that there is not one truth anymore. So, long time ago, we thought, that the quantitative approach where we could gather this information and come up with something that could, prove our hypotheses to be true. I think we're way beyond that now, because now we know that, hey, there is more than one way of understanding things. There's more than one sort of knowledge and ways of getting to that knowledge. I wanted to share with you something that our team at Youth Wellness Hubs Ontario has been using, and it's called two-eyed seeing, and it's two-eyed seeing in Mi'kmaq language, and it's a conceptual framework for really equally considering multiple perspectives in the work that you do, and in particular in the evaluation work that you do. And two-eyed seeing means from one eye, you're going to see things through Indigenous knowledge and Indigenous ways of knowing and understanding. And in the second eye, you're going to see things through more of our mainstream understanding and knowledge. And together, you're going to incorporate both of those eyes together so that you can benefit from all of the different truths and knowledge and approaches. I think you can move that ahead. So equity and evaluation challenges us to think differently about our work. Number one, considering the diversity of our teams. So who is sitting around the table? And someone had said to me, well, why does it even have to be a table? Which is a really great point, because maybe that's not how we include everybody who needs to be around our discussions. But, you know, as I said before, are we including the perspectives that are normally unheard or discounted for? You know, we could talk all day about the cultural appropriateness and validity of our tools that we're using to assess. For the most part, most of the mainstream tools that we adapt in our service kind of pathways, they haven't been culturally normed. And the surveys that we might design ourselves, we know for sure that they probably are not reflective of all the needs of all the diverse experiences, not just culturally, but the neurodiversities, the linguistic diversities, the gender diversities. And so it's really important that we think through, are we collecting the data that we need to be collecting in an appropriate manner? And, you know, I always say this, you know, are we making some participants in our evaluation like invisible because we combine different categories together? Because on my screen, I have this graph and I can't fit 12 different ethnicities. So I usually, you know, take the highest ones and then I put everything else in another category. I was probably doing that, you know, 15 years ago. I do not do that anymore. I don't care if it looks messy or whatever. You want to make visible everyone that has participated in your study, because that's meaningful. That's meaningful for them. It's meaningful for us. When I think about our research designs, as I mentioned earlier, you know, ensuring that you're always trying to do a mixed methods design, because through the mixed methods design, you are going to be able to incorporate multiple perspectives and really have some of those approaches like photo voice or storytelling, or even interviews and focus groups of diversity. And recruitment strategies, you know, I think a long time ago when we weren't really thinking about equitable approaches and evaluation, we had the standard recruitment where we had a flyer or we had an email go out or we put a poster up. And we know that that's not going to reach a lot of the voices that we actually want included. And so how are you recruiting? And how are you ensuring that if people want an opportunity to participate, they can? Sometimes they don't want to. And, you know, I'm going to mention this a little later, but if the project or the activity or the intervention that you're trying to evaluate hasn't incorporated equity in it, you can't actually then have an equitable evaluation. Like, it's almost impossible. Because to achieve equity in evaluations, the intervention that's being evaluated had to have been equitable. It means those very people, at the very least, those informants, had to have an equitable role in that program development, in that program implementation, so that they can have a meaningful role in the evaluation. Okay, Daniel, you can go ahead. So in the field of sort of quality improvement and implementation science, we think of what is called a PDSA. And a PDSA stands for Plan, Do, Study, Act. And in our approach to incorporating a health equity or an equity lens into all of the processes that we do for evaluation, it's about this reciprocal learning health organization or learning health system that we're all a part of, that we're going to plan something, we're going to do something about it, we're going to study it, and then we're going to change it if we have to do it. So I always encourage everyone I work with is that this is a really important sort of feedback opportunity. So it's not just evaluation for the sake of evaluation, it's to actually improve the work that we're doing. And how can we do this? By incorporating our equity considerations. I'm going to show you some kind of examples of that. Plan. So number one, when we think about a PDSA cycle for incorporating, equitable approaches in our evaluation. Does the project, as I mentioned earlier, integrate health equity considerations of intersectional experiences throughout? If your program that you're evaluating, didn't involve in the development phase, in the implementation phase, the diversity of students that exist on campus, your evaluation is going to be limited, and the evidence from that evaluation is going to be limited. What does that project team look like? I mentioned earlier that it's important that the team membership really includes members of which this evaluation is going to impact and potentially influence. And here I list, gender, cultural, and racial identities, but there are so many different identities. And we need to ensure that we're able to include them if they want to be included. How are the needs of your target population being addressed in the project? What barriers do participants face in their involvement or engagement in the project? Meaningful engagement of our stakeholders, it takes time. And oftentimes the structures by which we work in do not allow us to have that meaningful involvement and engagement with the community by which we need to work with in order to have our evaluations focused and centered on engagement and equity. And I used to think that if you just minimize the barriers to participation, that you were doing enough when it came to sort of equitable evaluation. But that's just, that's just the start, because we know that, the participation is one part of the research cycle. It doesn't include sort of who designed the study. It doesn't include the interpretation of the data. Are you going back to your community and saying, hey, like, does this resonate with you? Is this how you would interpret this? This is your work, this is your data. Tell us now how we should share it. What kind of report should this go in? And again, when I said, the structures by which we work in don't always give us the time to engage, it also doesn't often give us the money for that engagement piece. But I always encourage all of us who I work with is that, we need to start budgeting for the engagement piece. We need to start budgeting, you put in money for honoraria because you want to engage the community where it matters and you want to, compensate them. But sometimes we need a bigger budget and a scope to allow true sort of engagement and true reflection on what this project should look like from all members of our communities. So the second part of the PDSA style is, study considerations for equitable evaluation. So do your evaluation questions allow for or promote exploration of equity issues? So when you're designing your evaluation questions, are you thinking about the differential impacts of your service, of your program by different groups? That's one way that our evaluations can actually explore equity. Do your evaluation questions pertain to some of the structural or systemic drivers of inequity? Are you ensuring that the data collection considers a broad range of perspectives? So, you need to think about the fact that not everybody wants to, do a paper and pencil survey. Not everyone might access things electronically. There are literacy considerations, there's language barriers, and are you including all of those kind of broad data collection perspectives as part of your plan? Now, of course, understanding the limitations of our work is really important. And we're not going to always be able to incorporate all aspects that we need to, but being able to recognize what we should do and working towards that with each and every evaluation that we're doing, I feel is like a really important step in all of us moving towards evaluations that are focused and centered and very intentional around equity. Yeah, and so I've mentioned some of these about disaggregating data by different demographic characteristics. That is something that is really, really critical. And a lot of times we want to throw everybody in sort of a gender diverse category. When I have started to now do our analyses and we look at sort of how young people who are identifying as gender diverse, how they're doing with respect to their mental health, how they're experiencing services, you see dramatic differences in how they are experiencing services compared to, let's say, our cis women, our cis men. And what's important about that is that if we're trying to make decisions based on evidence and you're not, looking at different demographic characteristics, how are you going to know whether you're reaching, you're serving, you're understanding the needs of the diversity that exists on campus or in the community if you're not doing these pieces? And so it's of course a way to advance our equity approaches. And one thing to advance equity and evaluation is our consistent collection and use of socio-demographic data. And we're going to talk a little bit about this because it's something that Daniel and I really feel strongly about, that everybody, whenever you're collecting evaluation data, some of this socio-demographic information has to be included in order to advance our understanding of equity.
Thank you so much for that, Debbie. That was great. So now we're going to turn our attention to social demographic data. So what is social demographic data? So social demographics are social and demographic characteristics of a person, a group of people, or a population. Generally, characteristics include things such as age, gender identity, sometimes it includes pronouns, language, sexual orientation, ethnicity, housing, income, etc. Social demographic data is just a group of statistics of these characteristics for a given group of people. So for example, if you're hosting a group for a program, then the social demographic would be of those group of students who participated in your program. And as Debbie mentioned, the collection and analysis of social demographic data is one way towards addressing equity in evaluation. So now we're going to go to our next poll question. So again, using the Menti website, how many of you collect social demographic data as part of your programming and/or evaluations? And please use the link that we shared in the chat. Great, and it seems like approximately 80% of the participants use social demographic data as part of their programming. 15% do not collect social demographic, and approximately 3% of folks feel like this is not applicable to their role. Oh, and there is a hand raised, I see. I think we're going to be answering questions at the end. So we'll get back to you then so you can ask your question. Okay, and moving on. So what are the benefits of collecting social demographic data, and how does it advance equity in evaluation? So why should we bother with collecting this information? Well, because it can help you to understand how your programming or your project is impacting folks of various intersecting identities. So for example, you can first and foremost identify who your program is reaching, and therefore also who it is not reaching. Collecting this data can also help you identify the differences, whether it's strengths and/or challenges, that different groups, subgroups, and folks with diverse intersecting identities may be facing in general, but also facing as a result of or in response to your project or program. These are some of the benefits to collecting this information, but it is important that you use this information. You must use this information to develop strategies to address the needs of that you identified. For example, you can use this information to develop strategies to better reach and engage with groups and subgroups you are not currently doing a great job at engaging. It can also inform strategies that can make your programming more equitable to these individuals. So really, as long as you're using this information, there will be benefits that you'll be able to appreciate as a result. And really, collecting and using social demographic data is the only way to identify the needs of each community that you work with and know the impacts or lack thereof that you are having in supporting them. So now let's talk about big picture considerations as you prepare to collect social demographic data. Everyone is eager to collect data, but folks don't always have clear objectives on how the data will be used and how the data will be translated into meaningful action that benefits those who you are collecting data from. We must recognize that oftentimes people are asked to provide their data and their information that oftentimes makes them feel vulnerable, leaving them feeling exhausted and over-engaged. You must also recognize that social demographic data collection in itself can be traumatizing. if you see that nothing beneficial comes out of you sharing that information. We need to balance this potential harm with clear benefits to individuals and communities. So it's always important that you have a plan on why you're collecting this information and how you plan to use it. And also, we need to have humility and intentionality when collecting and using this data. We can enact these principles by asking ourselves the following questions and developing evaluation plans that answer them. So, what do you need to know and why? So how are you going to use this information? You'll need to consider the information and data that you currently have available, and how is this data currently collected and by whom? So you also want to make sure that if you have some of this data already available, you're not asking people over and over to provide the same information. You want to know if you have the capacity to collect this information in a safe, anti-racist, trauma-informed, and meaningful way. So you want to make sure that your staff have the capacity to collect this information in a way that's safe for your participants. You'll need to think about how you're going to engage students to help determine the appropriate method to collect this information. So as Debbie mentioned earlier, there's many ways that we can collect information, and it's really important that you're engaging the people you want to connect this and get this information from. And lastly, but very important point, you need to identify if there's buy-in from your leadership team or from the folks that you're working with to collect and use this data. If not, it may be up to you to make that case, not just for the data collection, but also for the resources required to address the needs identified by your data. It is important to remember that data collected explicitly to make changes might be disruptive and may lead to defensiveness and backlash. So you must anticipate and prepare for this and plan for ways to bring people along. Now, thinking about some of the more practical considerations, and Deb already talked about these at a high level, so I'll just quickly go through them. But here are some reflection questions to help you to plan the practical elements of your evaluation approach. So this will bring you closer to being ready to collect social demographic data in a meaningful and safe manner. So once you've decided to collect this data, here are some questions that you can ask yourselves. So what are the right questions to ask, and what are the appropriate response options for each? As Deb mentioned, this is something that you will be able to figure out as you engage the folks that you're working with, and it is important that they are engaged throughout the process. When will you be collecting this data? So when does it make the most sense to collect this data from your participants? Are you going to do this as part of an intake process? Are you going to do this as an end of program evaluation? All of these questions are important to help you understand when is the best time to engage with your participants. And how will you be collecting this data? What makes the most sense for the people you're participating with, that are participating in your program? Will they be using paper forms? Will you be using online forms? And lastly, do you have resources available to share with your participants or your students to inform them why this information is being asked and how it will be used? So many times when we've done evaluations, when people don't know why you're asking these questions, or they don't understand your intentions behind it, they are not likely to share this information. But whenever you're transparent and you are able to have a conversation to them as to why you're asking this information and how you plan to use this information, then you will see a better uptake in people feeling like they can share this information with you. But if there's anything that you take away from this section of the presentation as it relates to social demographic data, is that the collection of social demographic data must come with a commitment and accountability to taking action. So many times in the past, we've collected data from folks that, like I said earlier, might be difficult for them to share, and we don't really do anything with it. We don't have any action, and that can be very frustrating for communities and can be also very traumatizing and exhausting. So it is very important that we are accountable and we have the commitment to take action. And then lastly, like that mentioned, responding to what your data is showing requires adequate resources to implement these changes. So it is important that we're making the time and the space, and that we have resources available to make changes to meet the needs of the communities that we're working with. And lastly, involving diverse and intersectional youth perspectives in the interpretation of the data and in decision-making for planning and implementing action is key. So really, they will help you to take your programs to the next level and making sure that whatever changes you are looking to make reflect what the needs are. And I will pass it over back to you, Deb.
Thanks, Daniel. So when we think about our actions, we need to think about what are the outcomes of the program, who is accessing the program and who's being left out. How are the benefits of the program distributed among different groups? What could be contributing to the distribution of benefits across group? How might those benefits of the program be more equitably distributed? And are any groups burdened by the program, and which groups? And so using the data, having, collecting it is important, but making sure that, we actually take action and that our decisions really reflect what our data is telling us is just as important. And there's a lot of ways that we can use the data. I think, Daniel, you can move ahead in terms of what are at the individual level, at the organizational level, at the system level. We'll talk about that. Okay, we'll skip to the poll. Okay, so how many of you have used socio-demographic data to implement changes that better serve the needs of your participants? And I was really happy to see 75% of you collect socio-demographic data, because as Daniel talked about before, there can be resistance to collecting this information. I want to tell you that, like, in probably 2 decades of research on young people, and that's the student population as well as the young people in the community, they actually like sharing information about themselves. They like sharing it in an interactive way. They like doing surveys. Oftentimes we hear from service providers and they say, young people don't want to collect. They don't want to answer these questions. And that's actually false. It's not true. And there's lots of research to support that they do want to. And from a service provision perspective, it's really important sometimes to know some of this information before you kind of meet a young person in your services. And I do a lot of work in the field of sort of measurement-based care and treatment-informed care. And so when you have this information prior to seeing a young person, a student in your services, and you're able to use some of that information in a single session, for example, when you don't have a whole lot of time to work with the young person, and you can gather some demographic information that can start those conversations, that can build that rapport. It looks like you've been in school, you live on your own, certain things might be able to sort of facilitate conversations faster when, we're working within really tight constraints in a single session. And so, as you can see here, yes, I've used this data to implement changes, which is terrific. No, I haven't used this data. No, I don't do it, but I might do so in the future, and not applicable. So I think we all fall into all of these buckets, because some of our work has been able to push these changes forward. Some of them hasn't. So how can socio-demographic data be used? I like to think of it systemically. If we think about the different levels by which we work in, and that if we're always focused on being a learning health organization or a learning health system at the individual level, when you start to collect demographic data to advance equity, you can think about, are there gaps in the services or the approaches that I'm using? Because the groups of young people that are coming to see me, I don't have services, I don't have staff, I don't have those things available for them. It can help to improve interactions with students, as I said before, when you start to kind of understand where they're from, who they are. You also can start to create safe and inviting spaces for young people. So when you start looking at your socio-demographic data and say, hey, like 44% of our young people coming to service are actually gender diverse. That's a huge thing to know. That means you've created a space where these young people who traditionally, in traditional mental health systems, have never felt safe, have never been able to access service, are now accessing services. That's a really important part of information to know. And when you start to understand, how different groups of people are experiencing your service, as I said earlier, you can start to improve. You can course correct when you have to. And you can then focus your outreach effects on those students who may not be accessing service but need to, and it's just not feeling that that's an appropriate sort of place for them to be. At an organizational level, Again, a lot of those same kind of considerations, but I like to think that at an organizational level or a program level or a department level, you can think about, informing recommendations based on certain decisions. You can think about human resources in terms of our policies, in terms of who we hire, in terms of ensuring everyone's voice and role are represented. We can think about communications when we talk about socio-demographic, clarifying, deepening the stories of those communities and those students that we serve. And if I'm a leader and I'm a leader on this call, I can think about allocating like sufficient resources to address the different needs. I can put in professional development funding or opportunities in place so that we can meet the needs of all of our young people. And at a systems level, I think it's critically important to think about how that aggregate data can be used to further our understanding of young people, not just at an organizational, but across the province, across the post-secondary sector. We can think about how this aggregate data can help us compare to other national surveys or national population data. If we know in the community that we're working, a certain percentage of demographic young people are living in that community, yet only 2% are accessing services on campus, that can give us some information of what we can do to improve our work. And also at a system level, like we can use this information more intentionally when we need to apply for more money, because we can then identify the needs of our diverse groups of people that we are serving. And that, of course, is related to the advocacy work. No questions from the audience, or now questions from the audience, Daniel?
So we don't have any questions on Mentimeter, but there are a few questions that we do have on the Zoom chat. So there's one question here about whether we can comment on collecting social demographic data on an optional versus required basis. And this person asking is saying that this information is helpful to have, but in their experience, they have always had conversations about whether to require this data or make it optional. So I guess I can quickly answer some of that, and Debbie, you can jump in if there's anything that I miss. In all of the work that I do, we always make these questions required, but what we do is we add the option of, I feel not comfortable sharing this information, or I'm not sure. And the reason why we do it this way is because sometimes just by knowing whether people feel safe or not sharing this information provides us with insights that will allow us to change the way that we're collecting information. In my experience, this hasn't really created barriers to participation, and it does give the people the opportunity to just tell us how they're feeling. And again, like I said, this is something that we can then use to tailor our programming to make sure that in the future, we're able to make people more comfortable with sharing this information.
And in the spirit of multiple truths, the work that I and my team have always done, we've always made those questions optional. And I think it's not so much in making them optional or mandatory. It's more in the communication that happens to those people that you're collecting this information about why you're collecting it and what you're going to do with it. So in Youth Wellness Hubs Ontario, when young people come to access service, the person at the front desk, when they register them and say, hey, what kind of service do you need today, or what are you here for? And they start explaining, I'm going to give you a whole bunch of questions, and here's why I'm giving you these questions, because we want to really make sure that we can find the right person to meet your needs, and we can have the right services available for you. So these questions are optional, they're private, they're confidential. They will only be shared with those people who are in the circle of your care, but know that we're going to use that information. So, I mean, I think both approaches work. There are multiple, advantages and disadvantages to both, but within a measurement-based care framework or a treatment-informed approach that many services are now embracing, that relationship that you establish with that person walking through the front door around why you're collecting this information is way more important than the information that you're actually collecting, because they will be truthful and honest and participate when they understand the why.
The next question here is another important practical consideration is research ethics requirements and limitations to collection of personally identified information. Sometimes you may not be permitted to collect extensive demographic data because of the risk of re-identification. Have you encountered this challenge before? Do you want to take the first step, Debbie?
Sure. So absolutely, you are governed by your REBs that might exist both at your institutions or at a community level. I mean, I don't think that it's a fatal flaw of any sort of protocol for you to identify different demographic information that you want to collect. It's what you're doing with that information, how you are going to protect the privacy and confidentiality of that information. How are you going to analyze that data? The reason why we have all these sections in an REB about how are you looking at gender, how are you analyzing, how are you collecting that, is because they want to ensure that you are protecting the rights and the privacy and sort of the integrity of the people that you're collecting that information from. So every REB is a little different, but provided the rationale is adequate in terms of really establishing the need for this, especially from a service improvement perspective, I haven't encountered those barriers. Now, I work with a hub in Halliburton who says, Deb, like we have one Black youth who come in for service. Like I can't show you that information because it's very identifiable. Absolutely, there are exceptions like that. But by and large, across a large organization, it's anonymous data. So when you aggregate it across, right, it's anonymous. You're not sort of identifying people by name.
Thank you for that. Let's see the other questions. There's one here that says we're in the process of developing a loose script and training for our frontline staff to better ask identifying questions of participants. Are there any resources that you can direct us to or the top 3 tips to share? So we do have a resource slide at the end of this presentation that you'll be able to access once the slides are shared. In terms of tips, do you have any tips to share, Debbie?
I missed the first part of that question.
Oh, sorry. They are in the process of developing a loose script and training for frontline staff to better ask identifying questions of participants.
Yes. Okay. So I would say go to We Ask Because We Care. It's the Toronto Health Equity. Just go Toronto Health Equity. It'll come up. And all the hospitals within Toronto have gotten together over the last 5, 6, I don't know, decade, and have put together even training and PowerPoint slides and resources to say, here are the demographic questions you're going to ask, and here's the rationale, and here's what you're going to say to people as you collect that information. And I love the title, We Ask Because We Care. This is why we ask this information, so that we can better serve you and better serve your needs and develop those things in place with that.
Perfect, thank you. And there's another question here. It's going back to the optional answers as they relate to social demographic data. When making an answer optional, how do you word it? We currently word this type of answer as prefer not to answer, but I am recognizing that this would not allow us to distinguish whether the person is not comfortable sharing this with us specifically or where they are choosing not to share for another reason. Mm-hmm. So I'll quickly just speak to that just because I've used that in the past. It's really about giving people the options of identifying why they're not answering, and you could just include multiple response options as a result. And there's always, it's always good also to include the other please specify option, and people might give you the opportunity. We'll share the information as to why they're not comfortable with sharing that information. But to be honest with you, just by providing different response options that get to, I'm not comfortable sharing this, I don't prefer to answer this question, or I'm not really sure, has worked in the past for me. Debbie, how about for yourself?
So in the instructions, and a lot of REBs require this, especially in the consent, you would write, all questions are voluntary. You can choose to answer any or all of the questions. You can leave them blank. And so you're prompting them to say, if you don't want to answer this, leave it blank. Prefer not to answer. It's hard to interpret that, but it's still meaningful information. But I would really clarify that in the instructions, that all of these questions are voluntary. You can skip ahead, choose to answer any one. You will not be penalized for, not all those pieces.
Thanks so much. And here, Deb, there's a question for you specific to the youth wellness hubs. So could Deb talk a little bit about the process being used to evaluate the Youth Wellness Hub, and how it is youth informed?
So Youth Wellness Hubs Ontario is a provincial initiative of 22 networks right now across the province, delivering integrated service delivery for young people between the ages of 12 and 25. What that means is that young people across the province can come into a hub and they can access services with respect to substance use, mental health, education, employment, housing, everybody integrated under one roof. It's a seamless kind of accessible approach. The model has been heavily designed and developed with youth and family engagement, strong principles around equity. Integrated youth services is not just a provincial movement, it is a national movement. And I know that some of you on campus, because I've worked with you, have tried to develop integrated models on campus where health and mental health try to come together and say, hey, we need to work together. We need to be in one spot. We need to communicate. We need to collaborate. We need to make sure that young people are not sharing their story 10 times. And this is what integrated youth services does. So how are we evaluating it? It's not an evaluation project, but what we are ensuring is that measurement-based care is being implemented. So standardized tools across the province to assess how young people are when they come in, with respect to a number of clinical assessments, as well as socio-demographic. And it's brief and it's thorough, and it's also done on an iPad, so it's interactive. And then we look at outcomes over time. So across the province, we don't have a really good understanding of how young people are doing in our services. And so I would say this is one of the first initiatives to really look at outcome data for young people accessing a multitude across all sectors of services. So we involve youth in the evaluation. They've helped pick our measures. They've helped with our data collection protocols. They help in design. They help in all parts of it. We have youth councils, so they really inform all of the work we do. We don't do anything without them, as well as families. So I've done socio-demographic data with our families, and they have said, why are you asking like my income, and why are you asking where I live, or why are you asking my sexual identity? How does that have anything to do with the services I want to reach? And so it's also about educating, even the adults we're collecting this information from, and families, about why it's important from an access and delivery perspective to understand some of those concepts.
Amazing. And we just have questions continuing to flood in. This is definitely a very hot button topic that folks are really interested in engaging in, and I wish we had more time. But I just want to take the last minute that we have and thank you, Deb and Daniel, so much for this amazing presentation, and to all of our participants for joining us and participating in today's webinar. I just want to let folks know that our next webinar is going to be on October 20th, again from noon to 1, and it's called Feeling Welcome, Creating Space for Indigenous Students at Guelph. So we hope to see you at that next one. Again, thank you so much for joining us, and please remember to take a minute if you can and fill out our survey that will pop up after this. Oh, Deb, please go ahead.
I just wanted to, I know people want the slides. Are you sending those out, or?
We can make them available on our site along with the recording.
Okay.
If you want to send PDF, well, I'll send you an email. We could sort it all out. And
maybe we'll do a part 2. Like, I know I always say that, but there's always more we can do. So, we'll think about that.
Amazing. Yeah, we will definitely be in contact. I think there's more conversation that needs to come out of this. So again, thank you all so much for participating. I know that there's a lot of love for you folks in the chat and all of the work that you do. And with that, I will say thank you all and